Hi, Acupressure and Wellness fans, it's Diego Roig, and before I leave the topic of ulnar pinky side wrist pain, I just wanted to share with you two more techniques. Yesterday I was in my office, I was sitting at my desk, and I showed you a technique where you can treat the trigger points in the forearm which are causing the wrist pain. Now remember, this is wrist pain that doesn't come about from a trauma, you falling, or you hitting your wrist. It's not from a ganglion cyst that may form in the wrist. This is wrist pain that comes from trigger points in the forearm, knots in the forearm, that come about from repetitive strain, from grasping and twisting and motions. That's the wrist pain we're talking about. So you treat that wrist pain by hitting the trigger points in the forearm. So with this technique, remember yesterday I was at a desk, I put a nice towel on the corner of the desk. Today we're going to use the Theracane. And the way we're going to use this Theracane is we're going to position it this way, and you see this wide point, that's going to go across the corner of your desk or table. And you get comfortable, we're going to use that knob there. I have it this way because I want this to brace my chest to make it as easy as possible. So a lot of times when I'm doing treatment, I do my best to not work hard and to use body weight. So here I am. I'm going to find that knot in my forearm that's on the ulnaris muscle that goes down to the wrist. And when I find that, oh, there it is right there. Now hold it 12 to 15 seconds. And what I'm doing is I'm going to kind of just lean forward from my waist. I want to keep my spine straight. I don't want to collapse my lower back where I'm slouching and bending forward. So if I bend my knees and I lean forward a little, what happens is my spine straightens, I'm leaning forward, and I can apply weight on that trigger point with no effort and no force from my shoulders and my arms. And that's the key with trigger point therapy, is you want to do it where you're not applying, like you're not forcing things. You're not forcing the release of a muscle or trigger point. You're just trying to use body weight and leverage. So here I am, I counted 12 to 15 seconds. And at about the 9-second point, what I want you to do is start. You can rotate your wrist, do a figure 8 with your wrist, right? As you count from 12 to 15. Open and close your hand. Twist your hand around if that's possible. Open and close your fingers. And when you're doing all those motions, because you're using the forearm muscles, at the point of therapy, you're breaking up scar tissue and you're really releasing that trigger point in there. Okay, so go ahead and do that for 3 to 5 minutes, and you'll notice your hand, your wrist and forearm will feel lighter and freer, and the range of motion will be better. The next technique is a technique where you lie on the floor face up, lie with your arms on your side like this, put a nice towel under your arm, okay? And you're going to need someone to help you. So what you do is you take another towel and you put it on top of your arm. You could use something thicker like a blanket. And in this position, you're relaxing there. Have someone lean on the back of a chair and apply their heel, like, between the heel of the foot and the arch of the foot, they can apply it right on the trigger point. So have them apply pressure there, and you can, you adjust it. It needs to be pretty strong in there. But when they apply the pressure, have them just keep it static, 12 to 15 seconds. And as they're doing that, what I want you to do is, under the weight of their foot, you start doing motions with your hand like this. You're going to do figure 8s. And it hurts a lot, but let me tell you, one treatment like this and you really can get tremendous relief. So you're going to have them apply pressure for 3 to 5 minutes, and for periods of 12 to 15 seconds you're going to be breaking up that trigger point. And then what you can do is ask them to lift their foot for a second during that 3 to 5 minute period and just slightly adjust it so they're applying pressure in a different location of that trigger point. They could also leave the foot there and just lean to the left for a minute, then lean to the right for a minute, and you're catching different parts of that trigger point. You'll feel it firing down to that wrist, and it'll hurt, but that's a sure way and a quick way to relieve wrist pain that's caused by trigger points in the forearm. Thank you for joining me today. Have a great one.